A rare treat indeed to see Brett on the news at 5. Well, Dr. Sara from Timberview Veterinary Hospital is back with us this afternoon with more help for your furry friends. Today, we're asking, should I choose elective surgery for my pet? This is a really interesting question because many of the things that maybe other people think is just routine surgery is really elective. Is that right?
Absolutely. You can decide if you want your animal spayed, neutered, or declawed. Those are some of the young animal basic care we think of, but it's really personal choice.
Okay, so spaying, neutering, declawing, all doesn't have to be done.
It doesn't have to be done, although a part of responsible pet ownership is making sure your pet is not indiscriminately breeding.
Okay.
The simplest way, of course, would have them sterilized, which would be spay or neuter.
Are there other benefits to having spay and neutering done?
Absolutely. Usually we think of those organs that we're dealing with, the things that make hormones and babies, that these are areas that are more prone to cancer, to infection in the females. And in retrospect, if they have a disease or a problem with it, there's no problem if it's been removed at an appropriate age.
Okay, that makes sense, absolutely sense. Are there risks though in performing surgeries that maybe you don't need to, or just in any surgery in general?
Yes, there are risks that with anesthesia, with the pain involved, inflammation, we try to mitigate those or make them as little as possible by doing appropriate exams, blood work ahead of time, see what the internal organs are like, having them on appropriate monitors and IV fluids to really try to reduce the risk as much as possible.
And you said there are some things just in, there's developments all the time, and in modern medicine there are things that you can do, and Timberview offers a lot of services for this.
Yes, we try to reduce pain throughout. We use multimodal pain control. We start pain control before they're ever on the table with injections and anti-inflammatories. We like to use laser. I absolutely want to use laser for declawing cats because there's so much less pain and swelling. That's the cutting laser. And then afterwards, we use that therapy laser, which you saw a couple weeks ago, to speed tissue healing and just make it a nice recovery for the pets. So the more pain control you can have in different forms, the less deep that general anesthesia has to be and the less risk overall.
Now, we understand spaying and neutering can have those health benefits, like you were saying, with hormones and the organs. But declawing, that's more of an ownership thing, isn't it?
It's a very elective procedure. It is a hot topic. In some countries, it's banned. Where I went to school, you're not allowed to declaw animals. And I see it as I'd rather an animal be living happily with the owner, not being fussed at and yelled at for doing destructive behavior, or worst case, getting stuck outside where it's at risk, where they could live in harmony with the animal, the cat specifically, so it's not tearing up things, or if the landlord says it has to be declawed, that they're complying and not trying to hide this animal from them.
Sure, it is a decision though. How can folks get in touch with you?
We're in Dillsburg, 106 West Cabin Hollow Road. Our phone number is 432-2513, and of course our website is Timber.View.Vet.com.
Very good. Dr. Sara, thank you as always for being with us.
Thank you, Amy.